Here at North Bristol NHS Trust, our staff are delivering great care to many patients every day. But we could always do better. We know successful organisations, particularly large organisations, build improvement into their day-to-day work. This is known as continuous improvement. The benefits of adopting continuous improvement are many, but primarily it is about improving the quality, experience and outcomes for the users of our services. However, we also know that adopting, spreading and embedding continuous improvement is challenging, particularly for a large, complex organisation like ours. Organisations which have succeeded adopt common principles and practices. At a principle level, these organisations understand that only those closest to problems, such as frontline teams, are best at finding solutions because they truly understand the challenges. They secure a continuous improvement commitment from their organisational leaders. They have a clear strategic direction and support all staff in working towards it. They have a common set of values guiding how they work, placing as much emphasis on how we improve as on the improvement itself. They go slow to go fast, recognising that this is a journey which continues year on year and moving away from reactive improvement projects. In turning these principles into practice, those same organisations invest in their staff through training in standardised improvement skills using common tools and techniques. Focus on fewer high-impact improvement priorities rather than attempting to improve everything at the same time, and increase awareness of and the ability to use data to understand problems, develop solutions and measure impact. North Bristol NHS Trust has begun this journey, starting with the development of our strategy and delivering it through our improvement approach. We have called this approach Patient First, which you may have seen described like this. Building on our passion to deliver even better care every day, it's important each of us here at North Bristol NHS Trust knows where we are going as an organisation and how we will get there through our Patient First approach. Where we are going means consistently delivering outstanding patient experience through our trust objectives of delivering great care, developing healthcare for the future, and doing so responsibly by being an anchor in the community. How we will get there means focusing on fewer improvement priorities, developing improvement skills across the organisation, and living our MBT values through our behaviours. Let's take a look at our improvement priorities. Delivering outstanding patient experience is our ultimate aim for every patient. Developing even higher quality care means continuously improving our processes, ensuring the ways we work are designed better to benefit our patients. For example, by reducing delays for ambulances handing over patients at hospital and improving access for cancer patients. Harnessing the amazing talent of our staff makes each of us together more than the sum of our parts. Improving together means we can introduce even better treatments and outcomes for our patients through innovating to improve, testing our ideas, and research. Sustainability means we all have a responsibility to reduce waste and make the best use of all the resources available to us. We know that when our people feel valued, they are more likely to be highly engaged and motivated to deliver great care. We want to make sure everyone feels proud to belong here at MBT. Commitment to our community is about being actively involved in improving the health of our local community, being a good neighbour, reflecting our local area's diversity, and encouraging local people to want to join us at MBT. Finally, how we all behave and treat each other every day is really going to bring all of this together. You helped us understand the values that mean the most to you in your working lives here, and more importantly, the behaviours that show we live those values. Living our MBT Cares values of caring, ambitious, respectful and supportive ensures we appreciate each other for the valuable contributions we make to delivering outstanding patient experience. As you've heard, our patient-first approach is about setting an overall aim, where we are going, and agreeing priorities, how we will get there. It's also about leadership and building our skills through improvement training and practicing what we learn. Now, let's look at how you, as individuals and teams, can get involved. This can be in a number of ways. Be curious. Ask questions about the way we do things and about how we might improve them. Feed back your thoughts and ideas on how things could be better. Get involved in a colleague or another team's improvement project as a great way of learning how to begin your own improvement journey. Acquire new skills. Our Patient First team is delivering a range of new training opportunities, including individual training, learn how to use improvement tools and techniques, and how to use data to better understand problems and design solutions. Team training. Be part of our Patient First delivery system, Team Training. Join groups of individuals being trained together to understand how to address bigger process problems. Leadership training. For those who lead teams to help team members to use new improvement skills in a way that is encouraging and supportive. Live our MBT Cares values. Live our values through your everyday behaviours, ensuring everyone's contribution is valued and respected, and creating an environment where our service users are always treated with dignity and respect. Get in touch. Learn more about how you can get involved with Patient First across our organisation. Please reach out to our Patient First team. Search Patient First on the intranet. Email the Patient First team if you have a general inquiry, or if you want to find out more about training. And you can also call the team. Remember, while living our values is an expectation while working at MBT, getting involved in our Patient First training is an opportunity. The more people who join this approach, the better chance there is to come up with and put in place new improvements, no matter how small, every day.